Good morning, afternoon, evening, everyone. I am thrilled to welcome you to our first webinar of 2024, a platform dedicated to sharing insights and real implementation use cases into the positive impact that GS1 standards bring on hospital processes, fostering efficiency and enhancing patient safety. My name is Mónica Soler, and I'm honored to be your host for today. So without further ado, let's embark on this educational voyage together. Before going on to the presentation, I would like to briefly remind you on the GS1 competition law caution under which all GS1 meetings are operated. Remember that the purpose of this group is to enhance the ability of all industry members to compete more efficiently. This means there shall be no discussion of prices, allocation of customers, products, boycotts, refusals to deal, or market share. If any participant thinks the group is drifting toward impermissible discussion, the topic shall be tabled until the opinion of a council can be obtained. The full caution is available for you should you want to read it in full via the link below. So today, the webinar delves into the critical challenges within hospital supply chains that are vital for delivering quality and safe patient care. We will explore today how leveraging the standards and also introducing automated processes enhances operational efficiency and, more important, ensures patient safety. Our speaker today, drawing from a first-hand experience in implementing these practices, will also share key insights for successful barcode scanning implementation in a hospital pharmacy and also at the point of care. So get ready to uncover challenges, solutions, and transformative strategies for efficient and secure healthcare delivery. We are honored to have today with us Mr. Sotήριος Tsιάφos, hospital pharmacist and supply chain operations at the General Hospital of Athens, Greece. So welcome, Sotήριος, today, and thank you for joining us. And the floor is yours.
So as I was saying, our pharmacy department runs the supply chain for pharmaceuticals. We do the procurement, we do the warehousing, we do the dispensing. We also manage some medical devices, and we have a cytotox compounding lab where we do the cytotoxics dialysis and preparation. And we also have a toxicology and pharmacokinetics lab. Our hospital has more than 13 million euros annual spent in pharmaceutical and medical devices. That was back in 2022. This amount is slightly elevated in 2023, but almost 45% of this amount goes to pharmaceuticals and items controlled by the pharmacy. So what's the agenda for today's session? Just in brief, the challenges for a hospital pharmacy, the regulations that affect the pharmaceuticals and medical device supply chain, the impact of GS1 standards on efficiency and patient safety, and practical implementation in a hospital pharmacy, and how we did this in our hospital, and lastly, challenges, solutions, and the conclusion. So let's think of the patient pathway inside a hospital. So as the patient goes through the various departments and clinics, he consumes medicines, medical devices, consumables, and of course services. And at the same time, a large amount of information is produced for that patient, for this patient. Clinical data, lab test results, diagnostic images, drug prescriptions, doctor's orders, etc. So to support patient care and the work of clinicians, multiple supply chains operate in the background and run all over the hospital. Supply chains for medicines, for medical devices, for foods and groceries, even for fuels. Considering the significance of the healthcare services, The logistics operations inside the hospital are intense and also must be efficient and effective, as there will always be the need for the right item, the right product, the right medicine on the right or the right medical device to be available at the right time, at the right place. For example, a life-saving drug, or maybe a chemotherapy compound, a surgical item, an implant, etc. So it is safe to say that inside a hospital, supply chain is a crucial function of great significance, even though, and I know this very well, sometimes in many cases, this function is underestimated and doesn't get the proper attention from the higher management. Actually, what we do is logistics. You can see the 5 rights of medication administration and also a short, brief logistics definition. They are quite the same. So this is to showcase that, especially for a hospital pharmacy, sound logistics processes ensure the availability and quality of pharmaceuticals at various clinics and departments, ensuring proper care and patient safety. And if we want to effectively operate our hospital supply chain, as I said, we need to record and accurately record huge amount of information, because we need to always capture product codes, patient IDs, caregiver IDs, locations, timestamps, lot, batch, and serial numbers of medicines and medical materials. Serial numbers, crucial in the operating room or in other instances as well, other departments. Inside a hospital pharmacy, we do a lot of warehousing, because every day we have goods receipt, we do inventory management, we have procurement procedures, we check every day expiration dates, we actually use the first expired, first out stock policy. So we also need to know not only the product codes, the medicines, also lot, batch, which lot and batch is dispensed, in order to be able to trace pharmaceuticals and medical devices and carry out immediate recalls if needed. So at the wards and clinics of the hospital, we also must ensure that the right medicine and dose is given to the right patient at the right time and from the right route. These are the 5 R's. And this action must be correctly documented and recorded in the patient electronic health record. And I guess that now it is crystal clear that inside a hospital, supply chain information in many instances is also part of the clinical information. And this is the best proof that supply chain work and clinical work are the 2 sides of the same coin. That coin is to providing the proper care to our patients. So in conclusion, the efficiency of the hospital supply chain and the safety of our patients demand good quality, reliable, trusted data that are recorded into the hospital's ERP and EHR system. In a modern hospital environment, as you can understand, all this data capture and recording cannot be carried out manually by hand, because we talk about huge amount of data, and that means that we need a huge amount of time, a vast amount of time, and of course, manual processes mean that errors will occur, and caregivers have to spend their valuable time to administrative tasks instead of focusing on the real job, which is the patients. So we have to capture all this data at the right moment, usually when the event happens, instantly and correctly. That means with no errors. So this is where standards came into the picture, because the use of national or global standards for data structures and procedures of hospital information systems enables strict information standardization and set the basis for automated, fast, and error-free data capture using machine-readable data carriers such as barcodes and RFID tags. So trusted data adds to the effectiveness of the supply chain, the safety of patients, and support the clinical work of healthcare professionals. But really, how can we achieve the appropriate level of standardization that will ensure the efficient operation of our hospital supply chain? And this is where regulations come. So a brief note on the regulations. At least these that I am aware about. We have, of course, the Falsified Medicines Directive about drugs of prescriptions that is in use in European countries, not in my country yet, but in about 1 year from now, it will be effective. We have the medical device regulation, the European medical device regulation, and also the in vitro diagnostics regulation, also the European regulation. And also there is the Drug Supply Chain Security Act in the United States. All these regulations outline requirements for product tracing and necessitate the use of unique barcode identifiers on prescription drug packaging and medical devices packages. Especially for UDI, I know that FDA requires a unique device identification for medical devices in order to enhance traceability. And the FMD requires the use of unique identifiers, including 2D data matrix barcodes on the packaging. And these barcodes are used for product serialization and also authentication. And I'd like to briefly explain the magic behind the barcodes. Actually, barcodes, other linear or data matrix, as you can see on the slide, are data carriers of all the crucial information that we need. So you scan once a barcode like this, and your system, your hospital ERP explicitly identifies a product, medicine or a medical device or other, and at the same time collects, scans and collects all relevant information for this product, the lot batch number, the expiry date, and maybe the serial number of a medical device or pharmaceutical. And at this point, it is important for hospital pharmacists to understand the benefits of different product codes, GTINs, per packaging level of the same product. This is called package hierarchy, because many pharmacists believe that when, for example, scan products in the warehouse or do a goods receipt, they have to scan each and every packet every time, but this is not the case. And different GTINs for different packaging levels. And if we have this relationship between the package, the bundle, and the case in our pharmacy's warehouse system, it allows us to scan only once and capture the contents of the whole package. Either it is a case, a pallet, a bundle, or a secondary package. And this means that we have speed and efficiency in our warehousing operations, and we don't have to scan every single secondary package each time. And I wanted to stay on this because this is a usual misunderstanding if you don't have a thorough knowledge of how the system works. And let's move on to the impact on patient safety and operational efficiency. So we can summarize that the impact of GS1 standards and barcodes on hospital operational efficiency in three main areas. First, we have the inventory management and procurement. Inventory procedures like stock counting, drug dispensing, goods receipts can be carried out accurately and in less time with practically zero errors, because barcode scanners machines, they do not mistake, they cannot make mistakes. So this way we streamline pharmacy operations, and we result in more efficient warehousing. And we have significant working time gains for people in the pharmacy, and also better control of pharmacy inventory. That means less waste due to expiration and less financial loss. Also, accuracy in our stock enables more accurate demand forecasting and results in better long-term procurement strategy. Furthermore, the ability to track every product packed through the hospital supply chain from pharmacy through to the point it is consumed can be very beneficial. And this is important in hospital settings, as products frequently do not remain in the packaging they are delivered in, and being broken down into smaller units and transformed through repackaging and administration preparation stages. Of course, detailed information can be captured and recorded not only for pharmaceuticals, but also for medical devices and other pharmacy-owned hospital supplies as well, like, for example, medical gas cylinders. And this is a project that we are planning to roll out in the next year in our pharmacy. Second area, manufacture procedures and repackaging. Transforming a secondary package to unit doses. Utilizing barcode scanning can ensure that the correct products are being used during the manufacture process. And for example, a single unit created from breaking down a pack will benefit from scanning by ensuring that the correct products are being used, that accurate data are captured and recorded on the process performed, including lot and expiry date. And we can ensure that the resulting units are accurately marked with barcodes, and the relationship between the inbound product and the resulting outbound product are ensured, and full traceability is maintained. And the third area, and I think the most significant of all, is the area of clinical processes, because utilizing barcodes and scanning will help us to reduce human errors involved in the identification of products, but also automates the collection of data about the selected medicinal pack. Capturing the product code, lot batch, and expiry date automatically leads to better documentation in both clinical and logistic systems. And as the barcode is machine readable, it also allows more use of robotics, which drive both a reduction in errors whilst reducing workload, giving pharmacists, caregivers, and clinicians more time to focus on providing care. We have a very nice example here in Greece of the utilization of barcode scanning and GS1 standards in a robotic system at the pharmacy of the Chania General Hospital in Crete. This is a very recent implementation, maybe a little more than 1 year active. This robotic system has automated the dispensing of whole drug packages, scanning their product, their package barcode, either a linear barcode that we use in Greece, or the data matrix barcodes according to FMD. And this system is fully integrated within the hospital's information system. So it is a huge development and a huge step forward for our fellow pharmacists at the hospital of Chania, and a showcase that I'm proud of showing here with us, sharing here with us, with you today. As of the benefits in patient safety, barcode scanning, actually accuracy in dispensing procedures means safety for our patients. So barcode scanning means that enhanced accuracy in drugs and medical device identification when dispensing pharmaceuticals, means that all these items are automatically identified in the drug master database of the hospital. And this way we avoid human errors due, for example, similar packaging. During the dispensing procedure, a scanned drug or a product that is not in the picking list will automatically raise an error for the user. And when scanning at the reception point of the pharmacy, when we do goods receipt, lot and batch numbers can be captured automatically, are stored in the pharmacy inventory database, and allow us to trace the product not only inside pharmacy, but up to the wards, the operating room, clinics, or other hospital department. Expiry dates can also be scanned at each step of the product movement, along with the lot batch data, as the drug moves through the supply chain, enabling the check of the expiry date. So we are sure that we will not dispense or we will not give to our patient an item that is expired or recalled. So we minimize the chance of picking on the shelf or using a recalled or expired item or drug, and this enables faster and more accurate recalls, thus significantly adding to patient safety. And of course, pharmacy staff and nurses at the wards focus more on their duties and not spending their time on administrative tasks. And we can also we also have, as I mentioned before, more accurate and more complete electronic patient record. And also traceability traceability is highly, how can I say, utilized, because traceability traditionally has been a manual and paper-based process. And you know that we all know that it's very labor-intensive, it's slow, and uses clinicians and pharmacists' time. And when a drug is administered by scanning or a device is used, the product information is captured inside the electronic patient record, so we can manage recalls easily, quickly, and down to the individual patient, even if the patient has been discharged from the hospital. And this is a screenshot of a sheet that records the items that were used, products that were used in the OR against the patient. As in our hospital, as you can see, we have detailed product data recorded at patient level. We have the GTN of the product. We have the subcode of the product. We have the description and also of the product, and also the lot batch number. That means that we can trace this item down to the single patient. And as of the implementation, let's go to the practical side of the implementation of barcode scanning in a hospital pharmacy. And let's try to make a short guide how to implement barcode scanning in hospital pharmacy workflows. From my experience, the main, you have to start from understanding GS1 standards. You have to familiarize yourself and your team with GS1 standards, especially those related to product identification, location identification, barcodes and serialization. Basic knowledge and not need to dive deep into details. And you always can ask your local GS1 member organization for help and training. And because basic knowledge of GS1 standards will help you move forward to step number 2, which is to identify the specific points, pain points and inefficiencies where you would like to work on, and business procedures you'd want to utilize GS1 standards. So step number 2 is identify pain points. Procedures that you want to streamline using GS1 standards and barcode scanning. Usually, a good starting point is the pharmacy's inventory and all the associated procedures like goods receipts, dispensing, stock counting, etc. But all other functions of the pharmacy can be addressed as well, like the cytotoxic drugs preparation lab, like tracking of pharmacy's returnable assets, as I said before, the medical gas cylinders, tracking of controlled substances, and practically every aspect of the pharmacy's operations can utilize GS1 standard. Next step, write down in detail all the necessary changes. in procedures, in all the functionality and all the business of the pharmacy. And you have to consider subsequent changes in hospital IT systems, in software, in data infrastructure. And my advice here is do not try to boil the ocean at once. Try to keep things small and simple at the beginning. And this way it will be easier to start, because the bigger the change, the harder the implementation and the larger will be the investment. And usually we all know that funding is an issue. So we have all the necessary changes written down, and now we have to estimate the project's budget in order to go to our higher management and ask for the money. Here you also have to consider not all the changes in the pharmacy procedures, but also hardware needs, and this can be in cooperation with your IT department, because you will need barcode scanners, you will need label printers, workstation, maybe different network infrastructure. And also don't forget that we will surely have to change and alter your software platforms. So there will be software development needs. And have in mind that not all hospital ERPs fully support GS1 standards yet. And most vendors they don't know much about how to implement GS1 standard in a hospital setting. I would say that you should consider a pilot first as a proof of concept, because a successful pilot project will demonstrate the benefits of GS1 standards and barcode scanning to the higher management of the hospital, and will help you gain the further approval of next actions and the budgeting. And also, as it happened to our hospital, positive results will attract interest from other departments, and they will also want to go on with implementations like like this that you have in mind. You have to engage all other departments or specialists early in the project, and this is crucial, because you have to educate, explain, and train all project participants. It may be IT, procurement, nurses, maybe physicians, if the project is going to extend to other care units of the hospital. It is vital that all those involved inside or outside of the pharmacy will understand the benefits of such an implementation. It would be nice to integrate your software with the GS1 data hub or a similar platform, maybe your national medicines verification organization, or maybe another data pool of medicines and medical devices. I would suggest consider GDSN data pools if you have almost in every country there are GDSN data pools in order to easily access accurate and up-to-date product information. And also have in mind that you might need to have the ability to decommission package serial numbers according to FMD rules, but I'm not going to go into detail on this right now. Of course, think that you have to leverage GS1 standards for master data synchronization that goes with the GDSN data pools that I mentioned before. And my advice is that you should invest in high quality, only 2D barcode scanners, because recent developments show that the future of barcode scanning in healthcare is 2D and only 2D. And I'm sure that in a couple of years from now, there will be no linear barcodes on medicines and medical devices packaging. Of course, don't forget the training. You have to train your staff. You have not only to educate them, make them understand why we do all this, why we begin this project, but we have also we have to train them and stay beside them as the project evolves, and hear what they have to say, and support them in order to understand the necessities of the project. What we did in my hospital with GS1 standards. So we didn't start from the pharmacy, actually, and our main point of pain was medical devices and certain pharmaceuticals used in the OR, because we had our own hospital proprietary product codes. We have a great difficulty in identifying our products, in recording the items that were used in the OR. We did a lot of manual registration of medicines and medical devices in the OR, and of course we didn't have a way to track lot batch numbers or serial numbers for high risk products. Of course, in the pharmacy and in the OR, stock visibility of certain items was limited and inaccurate, and that led to valuable hours that we lose searching for items and checking items on the shelf for their expiration date, etc. And of course, the risk of errors during the recording of the using of the items that we used in the OR was very high. So we decided to begin a small project as a proof of concept in the OR, and we selected certain pharmaceuticals and medical devices that we wanted to work with. And we didn't invent our own codes and barcodes, but and this is the actual point of important point, that we used the GS1 barcodes that was on the products, was put on the products by the suppliers. And another main point of the implementation is that we scanned at the point of care inside the OR just before the surgeon was about to use the item. And what we did, we actually scanned a linear or a 2D data matrix barcode at the point of care, capturing crucial product data. The GTIN, this is the product code, the global product code, the lot batch of the item or the serial number, and we also checked with the expiry date on the label. And because we needed to showcase positive results quickly, we didn't try to make big changes to our ERP software or the HR database. We had a good, a very skilled development team in the IT department. And so we developed our own scanning software for the OR that did the job, and we had a separate master data database for only the data according to GS1 rules. And our implementation exchanged data with SAP and our EHR database. And actually, we were surprised by the results, because we saw that we gained significant how can I say that, benefits in terms of speed. As you can see here, we did an assessment, and we saw that we were over 83%. We had 83% less time to accurately perform a stock count of on the shelf. 4 minutes scanning versus almost 24 minutes doing the stock count by hand. And this is we managed to have full traceability of all products and also pharmacy products at the lot batch level. And this is a screenshot of our software. Some things are in Greek, so you probably can read, but you can see that we have in a screen, we have the product GT, the product code, we have the product name and batch. We also have the type of movement. This movement is that it was used on a patient. We have also all patient information. This way we can track products, all products, medical devices and pharmacy products used in the OR down at the lot batch level and at the patient level. And this is a slide that I always like to show. And on the left-hand side is a piece of paper that we recorded the items used in our CAT lab back in 2014, and the same recording sheet now using barcode scanning and GS1 standards. Now it's 3 years, almost 3 years before, but it still is in use, and we have all the information that we need, not only for our inventory but also for the clinical, the EHR and the clinical information. As you can see, we have the GTIN, we have the lot number, we have the serial number. So there are benefits. We have trusted data. There are benefits for patient safety, because we know what was used on which patient. We know exactly the expiry dates. We have also serial numbers. That means that we can track implants. And in terms of efficiency, we know exactly what goes out of our inventory. So we have stock accuracy, we have stock visibility, we can make better forecasting, and of course we have fewer losses due to expiration of items on the shelf. And last but not least, one of the biggest benefits of this implementation is that we managed to form a culture of change. That means that this means that nurses in the OR and the other departments that we implemented barcode scanning, after 6 or 8 months of using the new system, they didn't want to go back, and we managed to change their mindset about automation and the support of clinical work inside the OR or inside the CAT lab or in the pharmacy. What we learned in brief, as I said before, and start small, and don't try to change everything at once. It will be difficult and time consuming. And a proof of concept, a small proof project as a proof of concept will attract more attention, and there will be more people that they will want to implement GS1 standards and barcode scanning in their department. Trust your local GS1 office, seek advice and guidance, engage your procurement and your IT from the very beginning of the project, These departments are great helpers in such projects. Choose the function or the department that is easier to start or engage. And this goes with the first bullet in order to make the project, to start the project with the best odds, if I can say this. And of course, and last but not least, be very careful of how you will implement your software regarding end users, because end users like nurses and pharmacy staff, they need to see immediate results and benefits in their everyday tasks. So if you hand over to them software or a tool that is not intuitive and easy to work with, they will just put it aside and continue with their manual processes. So listen carefully to their remarks and requests and stay close to them, as I said before, supporting them and listening carefully what they have to say, and their especially in terms of the usability of the software. As for the challenges, this is a huge slide if we want to analyze it in detail. We saw that implementing barcode scanning in hospital pharmacies can bring about significant improvements, both on medication management, patient safety, and operational efficiency. But there are several challenges that may arise during an implementation process. First of all, integration with existing systems. You have to ensure that there will be seamless integration with the existing pharmacy management system and other hospital information systems, because this can be a complex procedure. Compatibility issues may arise, requiring adjustments or upgrades to current software and also hardware. Staff training and adoption. Introducing barcode scanning requires comprehensive training for pharmacy staff and nursing staff, of course. Resistance to change and the learning curve may slow down the adoption process, and adequate training programs and ongoing support are, as I said before, crucial, and to ensure staff members are comfortable and proficient in using the new technology. And there will almost certainly there will be workflow disruption, because implementing barcode scanning may disrupt existing workflows, especially during the initial stages. So this can lead to temporary decreases both in efficiency and productivity. So planning for a phased implementation and addressing potential disruption in advance can help mitigate these challenges. Infrastructure and equipment costs. Investing in barcode scanning infrastructure, including scanners and printers and related technology, can be a significant upfront cost for a hospital pharmacy. So there will be almost always budget constraints. So these constraints require careful planning and, of course, prioritization of equipment purchases. And last but not least, don't forget that the hospital has to be compliant with national regulatory standards. So meeting regulatory requirements in healthcare is essential, and non-compliance can result in legal and financial consequences. So you have to ensure that the barcode scanning system meet these requirements, and this is crucial both inside the pharmacy for the pharmacy operations and at the wards, if the barcode scanning goes at the level of scanning, bedside scanning. Another huge challenge, and I want to stay a little more on this, is the bedside scanning. Because if we don't scan at the point of care, we lose a lot. But for this to be able to, if we want to be able to do bedside scanning, we need barcodes on unit dose levels. But as you mostly know, manufacturers, not only all manufacturers yet fully support unit dose barcoding. So we have to find other solutions and implement other solutions like repackaging at the pharmacy level. And this is common, but not in Greek hospital, but in other hospitals in other countries. This is a common procedure, but is costly and is demanding, both in personnel and also in special hardware. And there are some also some other significant challenges. I said that we have the industry lack of support for unit dose barcode labeling. And I have to say that this is mainly for the pharmaceutical industry, because if the industry does not uniformly adapt unit dose barcode labeling, then there will be always a big challenge for hospitals to scan medications with standardized barcodes at the unit dose level. So we speak about reducing the effectiveness and of medication administration processes. And as I said, the repackaging is costly and labor intensive. Repackaging processes have to comply with certain requirements and can be resource intensive. And this additional step in the supply chain may contribute to increased expenses and potential delays in the medication administration. And also, don't forget that we need a user-friendly interface for the nurses and the healthcare staff. They, as I said before, they require a user-friendly interface to ensure the ease of use and the quick adoption of bedside scanning. If the interface is complex, it may lead to resistance from staff, errors in operation, and potential delays in patient care. So we should consider the following strategies in order to take care of these challenges. And first of all, advocacy for industry standards. We have to encourage collaboration between all stakeholders, healthcare organizations, industry, manufacturers, regulatory bodies, in order to promote the adoption of industry-wide standards for unit dose barcode labeling. And we should actively participate in the relevant industry groups that can help influence and drive this change. We could also optimize our repackaging process and explore new ways to streamline and optimize processes at the pharmacy. And this may involve that we invest in automation technologies, maybe negotiating with suppliers for pre-labeled medications on unit dose, or exploring alternate packaging solutions. And of course, we have to think for human-centered design in terms of user interface. We have to prioritize the development of a user-friendly interface for the bedside scanning system. We have to involve nurses and healthcare professionals in the design process to ensure that the system is intuitive, minimizes risk of errors, and aligns with the workflow of healthcare providers. Conclusion: GS1 standards play a pivotal role on transforming hospital pharmacies, and I will say enabling digital health and digital transformation in healthcare institutions. Not only provide a universal language for product identification, but they ensure consistency and interoperability across all the healthcare supply chain, from manufacturer all the way to the patient. And let's go to our main points once again. As I said before, enhanced patient safety. Barcode scanning at the point of care significantly improves patient safety, reducing medication errors. Accurate identification through standardized barcodes minimizes the risk of administering the wrong medication dosage or using the wrong route. Efficiency in medication management. Barcode scanning streamlines medication management processes in hospital pharmacies, from procurement to administration. This technology can optimize workflows, minimizes manual errors, and enhances overall operational efficiency. Supply chain visibility. Barcode scanning facilitates real-time visibility into the supply chain. Hospitals can track movement of medications, monitor inventory levels, optimize procurement, and improve supply chain resilience. Cost reduction. We can minimize the need for repackaging, and we can reduce errors in procurement and inventory management. This standardized approach ensures efficient utilization of resources and decreases operational expenses. And of course, patient-centric medication administration, because barcode scanning at the bedside enables a patient-centric approach to medication administration. It ensures that each patient receives the right medication at the right time, promoting individualized care and positive health outcomes. And one last word. This is a slide that I borrowed from St. James Hospital in Ireland. And this is exactly what GS1 standards and barcode scanning are about. And these are the wheels that will enable us to pull our everyday huge load of running and administering our hospital, not only for pharmaceuticals, but for medical devices and for many other parts of a hospital operation. And with this, I'd like to thank you that we had for your patience in listening my presentation. And I would like to hand over the floor to Monica for the Q&A session.
Thank you very much, Sotirios, for this comprehensive and insightful presentation and for sharing some key highlights of the journey towards enhanced patient care and operational efficiency. For sure, the project and the topic will provide for many hours of conversation. Unfortunately, we don't have more time. We are running out of time, in fact, so we have some questions from the audience. As we don't want to take up any more time of your time, I would like to channel all the questions to the speaker after the webinar today. If you would kindly take a little bit of your time to answer those questions after the webinar and return the answers to the audience after the webinar. I noted that some of you have submitted the questions anonymously, so we kindly suggest reaching out to us so we can facilitate the answers as well. So anyway, please let me ask you at least a couple of them if we have 5 minutes over the time. First
Yes,
one is related.
Time is not a problem. I have plenty of time. We can go on.
Maybe for our audience, so just let me ask you a question regarding one of the topics that you have mentioned at the beginning about aggregation. There is a question here which is quite interesting, and let me say maybe something that is not a trend but requested from many hospitals. The question is the request from this webinar to have aggregation for hospitals, or did I misunderstood the slide on aggregation?
Can you please repeat the question?
Yes, sure. I think Patrick is from the industry, is from Novartis, and he's asking if there is a request, you have a request to have aggregation for pharmaceuticals at hospitals, or not?
No, it is not a request for aggregation. It is a request for unit dose barcode labeling. I know that I haven't use we don't use aggregation. I haven't got any experience in aggregation, but I know that aggregation in hospitals is a quite complex matter, and every hospital has its own way of doing things in terms of supply chain operations. So I don't have experience, and I can't speak for my hospital for aggregation. And my request is that the industry should look at the unit dose labeling. And this is what I think that this is what hospitals need right now in order to move the barcode scanning from the pharmacy, from the warehouse, and from the ward small stock unit to bedside scanning.
Okay, thank you very much, Sotirios. Let's go for the next one. How much investment was required to automate and scan the incoming receipt of all the prescription products and devices? And then there is a second part, but I will stop here. So
yeah,
he's asking about
well, actually, the big portion of such an implementation is the software development that needs to be done, or changes in the ERP or in the ERP system of the hospital, and hardware is the investment of the hardware is much smaller. So because we did an in-house development, our costs were low, and we began the project in the OR, scanning all medical devices and pharmaceuticals with an amount of just 15 or maybe 20,000 euros, because we had only to purchase the hardware, the scanners, and the barcode labels. All other changes were made by our IT department. That's why we kept the implementation cost low.
Thank you. There is a second part on this question, and is asking about the workforce. So how much additional labor was required to scan all of the incoming inventory?
Well, this is not an easy question, because at the beginning you will surely need quite some people, because they are not familiarized with the processes. They don't know how to operate the software correctly, and I don't have a precise answer, exact number on this. Actually, the same people that worked before took charge of the scanning processes, and we didn't have to take more personnel in the warehouse in order to scan items, to scan the inventory, and if I understand the question correctly, this is not all this the project was moved forward in stages. So we didn't have to scan at once all the inventory, all the packages, or all the stock packages, and we moved step by step. So we did this in a time space of maybe 2 or 3 months.
Okay, thank you, Sotirios. We are 7 minutes over the time. So again, there are lot of questions still on the chat from the audience that I will really like to send to you, Sotirios, after the webinar, should you be able to answer it. Again, for those that has posed the question anonymously, I will suggest to reach us, and this way we can send back the answer from Sotirios after the webinar. So thank you very much again for your presentation today. Also, special thank you to our colleague from GS1 Greece, Iliana, for the support and contribution provided to the dissemination of this webinar locally. Today's webinar has highlighted the huge positive impact of GS1 standards and process automation in hospital supply chains. So by enhancing operational efficiency, ensuring patient rights compliance, and improving patient through accurate and product availability, GS1 standards plays a vital role in the often overlooked logistics and supply chain operations, as Sotirios stated. So thank you very much, Sotirios, again, for sharing your huge experience and expertise with our audience today. And let's take the lessons learned here and apply them to our own institutions, knowing that we have the tools and we have the knowledge to drive this positive change. Let's remember that our journey doesn't stop here. There's still much work ahead, and we encourage you to contact your local GS1 office for support to continue your efforts in creating a positive impact in patient safety. And finally, next webinar will take place on March 13 with another extraordinary project from Germany that you won't want to miss. So registrations will be open from mid-February onwards, so please stay tuned. Thank you, Sotirios. Thanks to the audience today. Goodbye and take care.
It was my pleasure. Thank you very much.
Thank you.